Hi everyone, I am Abdul Tofik, Assistant Professor, SNS College of Physiotherapy. Today we are going to see the topic of vertebral column and its deformities. Shall we start? Now, in this topic, we are going to explore the pathomechanics and treatment for the vertebral column. Uh, First, what is structure? The vertebral column consists of 33 individual vertebrae categorized with cervical column, thoracic column, lumbar column, sacral column, and coccygeal regions, providing essential support and structure to the body with an anatomical pulleys also. So, what is the role of vertebral column? It usually transcript the loading and unloading mechanism, and maintain the balance with the body. So, in the vertebral column, we have intervertebral disc. So, what is the intervertebral disc? It is a spongy-like structure. It is used to maintain the softness of the vertebra between the vertebrae. So, what is the role of the intervertebral disc? So, it observes serve as shock observers between the vertebra, facilitate the movement and reducing the impact during the various activities like injuries and trauma, while the games and jumping activities, and maintain the spinal health too. So, what is the principle of action of the vertebra? So, biomechanical principle of action as such as axial loading, bending moments, and shear force, they are crucial for understanding the spinal stability and motion. Affecting overall posture and function may be influenced with some of the other muscles that may or may not be considered to the vertebral column. So, the vertebral flexibility and supportive functions are uh, the range of motion, which allows the flexibility to vital daily activity due to daily activities like bending and twisting movements. The vertebral column provides support to the upper body and stability to the upper body also, and maintain the balance and doing the overall activity or ADL activity too. So, understanding the vertebral deformities. So, there are various types of deformities: lordosis, skylosis, scoliosis. Um, Congenital scoliosis, idiopathic scoliosis. Maybe it will be defined as two. So, idiopathic scoliosis characterized by the lateral curvature of the spine vertebra. It often with rotational movement of the vertebrae, and most common form of the scoliosis typically in adolescence period. So, what is the congenital deformity? Congenital deformity means in the child is by birth. It is a malformation of the vertebra with present child by birth child. This type can lead to complications like early interventions, maybe doing surgeries, etc. So, kyphosis, abnormal excessive curvature of, yeah, that means can we say? Uh, Abnormal excessive curvature of backward kyphosis. The spine curvature will be as hat shaped. So, and forward lordosis. So, leading the posture issues and the potential pain. The clinical implications are the understanding these types of aids in early diagnosis and treatment planning, ensuring the better patient outcome management and strategies. What are the post-traumatic injuries are caused by the affecting spinal structures? These deformities may emerge after the functions that may not be lost during the surgical procedures or any other implications, etc. So, to understand the deformities, the symmetrical and asymmetrical growth of the vertebra, which means anterior and posterior elements, that results in spinal deformities, leading the potential complications because of these issues. The spine may not be able to function regularly as maintaining the balance, stability, and postural deformities. The rotational mechanism may be get affected by the lordosis mechanism. The rotational deformity may be locked or unlocked mechanism that arise from the alternate loading conditions of muscle imbalance, that leads to muscle imbalance affecting the spinal alignment functions. And the shear force, because of these issues, the shear force of the bone may get affected. They create rotational instability. They contributing the overall pathomechanics in the vertebral deformities in various methods. So, the clinical importance are: the pathomechanism is a crucial to develop the effective interventions and treatment strategies for spinal deformity. It may get arise earlier. It may be able to treat in case of such periods of earlier interventions.